On behalf of the Board of Directors, it is my privilege to convene the meeting of the Board of the Southwest Regional Health Authority, open to the public, to welcome you and to account for the fiscal period 2021-2022. I thank you for joining us this afternoon. Your presence signals your interest and commitment to collaborate in ensuring that we continue to serve you by improving the quality of healthcare delivered within the Southwest region. The annual public board meeting is a mandatory requirement outlined in the second schedule, clause 12 of the RHA Act, which requires the Regional Health Authority to hold an annual public meeting to review the authority's performance in the preceding year and share its plans, goals, and targets for the current year. This meeting seeks to comply with the requirement of the Act and strengthen our commitment to the effective delivery of healthcare services by providing an opportunity for us to share information. As we deliver the report on the accounting period of 2021-2022, I urge you to take note of the board's intervention in critical healthcare matters, which positively impact service delivery. While significant resources were fixated on infrastructural improvements, particularly at the 68-year-old San Fernando General Hospital's main building, the authority was still able to maintain and not exceed spending levels. The board in 2023 and 2024 is looking forward to the following priorities being addressed, since they are aligned to the achievement of the 6 strategic goals and will impact positively on both patients and staff. And these are: 1, 100% of the emergency department nursing staff being upskilled and trained commensurate with the 24-hour filter clinic and clinical decision-making units. 2, introduction and implementation of additional adolescent health and men's health programs to prevent NCDs and decrease morbidity as part of a comprehensive strengthening of the primary healthcare system, adopting healthcare technology and information technology to modernize the systems, and improve primary care. 3, full relocation and expansion of the oncology services, including the introduction of palliative care services to meet increasing demand and address patients' needs. 4, completion of the care program within the La Romaine communities, along with the expansion in other remote communities of the southern population. 5, achievement of full baby-friendly accreditation status at the San Fernando General Hospital and expansion of the program to the Point Fortin Hospital. 6, strengthening of the community liaison unit with appropriate technology, information and communication technology, so that improvements to discharge planning can be maintained and tracking of clinic defaulters can commence. 7, accelerate the upgrade of the San Fernando General Hospital and the electronic security systems throughout SWRHA. 8, continuation and strengthening of the Quality Awards program to support continuous quality improvement initiatives, innovations, and recognize staff for their contribution. Thank you for your attention, and may God continue to bless the Southwest Regional Health Authority and Trinidad and Tobago.
I am pleased to share with you, the members of the public, and other stakeholders the annual report of the Southwest Regional Health Authority for the fiscal year 2021-2022. The period under review represents the second reporting year of the SWRHA Strategic Plan 2020 to 2023. We continue to progress during this period on a number of strategic and operational developments, which were monitored by quarterly performance reports and a novel risk enterprise management dashboard. Noting utilization data as outputs, we'd like to indicate that this is based on SWRHA strategic performance review, where we are pleased to report that we are reporting a strategic performance rating of 87% for the period under review across our 6 strategic goals and 70 objectives as outlined in our strategic plan. Each of the 6 areas are highlighted, and we will go into each into some detail, but the percentages range from strategic goal 1 of 89%, 93% for strategic goal number 2, and strategic goals number 3 to number 6, 88, 85, 83, and 92%. We would go into each one into more detail throughout the presentation. While the authority has made considerable progress as it relates to our strategic plan, we acknowledge that there still remains much to be done as we continue to explore ways of improving our delivery of healthcare services. The chest clinic was refurbished in phase 1 along the various infrastructural and aesthetic improvements noted at the San Fernando General Hospital. We are currently continuing in final phase 2 of this project. Some of our current initiatives include the increased pharmacy hours of service at our 3 district health facilities, installation of 5 artificial intelligence cameras at our various emergency departments, the electronic referral of patients from health centers to main hospitals, which essentially means that should you get a referral at a health center, you no longer have to go to the hospital with a hard copy referral to drop it off to get an appointment. That is electronically sent from the health center to the hospital clinic. Specialist clinics in areas such as obstetrics and gynecology. We have diabetes wellness clinics in primary care as well as in Point Fortin Hospital, child wellness clinics, child development clinics, diabetic counseling clinics, diabetic foot wound care clinics, and the reinitiation post-pandemic of the school health screening program as well as vision screening. Focusing in particular at Point Fortin Hospital, the Point Fortin Hospital vision includes being deemed the best same-day surgery center, not in Trinidad and Tobago, but in the Caribbean. We are aiming to create a hemodialysis center, the provision of a clinic dedicated to intravenous infusion and treatment, and a specialized center for wound healing. We are also anticipating the offering of limb-saving surgeries, which is an expansion of the already initiated surgical services at this facility. As the Chief Executive Officer, I will continue to applaud the dedication of all our staff, who without them, many accomplishments highlighted in this report simply would not have been possible. Amidst the uncertainty, adversity at times, and the need to adapt swiftly when required, you all have worked steadfastly to improve quality health care.